Only by delivering good customer service are we actually showing that we are listening to the patients and what they want.
We try very much as nurses to empower the patients, particularly with their minor illnesses, you know, the sort of common coughs and colds.
You see a range of different people with a range of different communication problems.
Health visiting looks after families from antenatal stage right up until when a child's 5 years of age, when they go on to school.
Hopefully we're trying to reduce the number of falls that they have, so keep them independent and keep them living at home for as long as they're able to.
It's important for me to talk to patients, hear their experiences and find out what they feel about their services and their care.
I assess and treat and provide management strategies for people with swallowing difficulties.
What we're doing is making sure that young people understand what services are out there for them, what the services offer. Also, we are trying to get the prevention message across to them.
We're in a health visitor. We sort of look after families from antenatal stage right up until when a child's 5 years of age, when they go on to school.
Well, the first visit that we've got today is a 3 to 4 month visit, which is where we get to introduce the idea of weaning. Our role is all about early intervention. What we do and what we recommend with families sort of sets them up for life, really.
This morning I've had 2 lovely visits, seeing a 3 to 4 month old baby, and it's been lovely just to do the primary visit now on a newborn baby. I did a visit antenatally, so I managed to explain the importance of bonding and attachment, and it's been nice to witness that happen in the primary visit. Mum's breastfeeding beautifully, there are no concerns, so it's a nice straightforward visit.
Well, my role predominantly is to help people with their swallowing, which is something that maybe people don't realise it's what we do. So basically I assess and treat people with swallowing difficulties. One of my main aims is to try and prevent chest infections, aspiration pneumonia, and that will, in the long run, help with sort of hospital admission. First of all, we're going to have a patient come in to see us at an outpatient clinic. This gentleman has had assessment prior to today, and he has quite a significant swallowing difficulty. I think a lot of the work I do on the wards is liaising with the nursing team, healthcare staff, speaking to physios in terms of positioning, occupational therapists in terms of cutlery. I think it's all about us working together as a team in order to provide the best patient care.
Today we're going to be going out and we're going to be going through some exercises with patients to help reduce falls and help improve mobility. So we're trying to keep them independent and keep them living at home for as long as they're able to.
I can see the improvements in her, and she does learn and she enjoys it. She knows she's never going to get up and sort of dance again, but it gives her independence back.
We work quite closely with OT, so when I was in the house asking the ladies if they got the aids and adaptations, we can refer on to OT and get our occupational therapy colleagues involved. We do discuss patients with the district nurses and link in with the district nurses. That's the rewarding part of the job, to go out and help people. That's why we're all in the job that we're in.
Social care is actually helping to support older people in the main, adults from 18 onwards, to live at home with as much independence as possible. We have the opportunity to work very much more closely with nursing staff, occupational therapists, physiotherapists. Integrated local care teams are in a much better place than many other single-handed organisations. We actually deliver far more personalised care to our service users and patients, and it's got to be a much better outcome for patients.
So today I've been looking at how we're going to be signing some young people up for the C card. Well, we mainly work with under 25, so what we're doing is making sure that young people understand what services are out there for them, what the services offer, what kind of experiences they would get if they came to one of our services. Also, we are trying to get the prevention message across to them to make sure that they have healthy sexual relationships. So, you know, the early intervention, giving that information means that they can make informed choices for their own sexual health. With young people in particular, even if it's only a few people, makes you feel like you've contributed to their life. So making sure that, you know, they are getting the right information, they do know where to go, and they're making the right choices for them.
The service opens at 7 in the morning, Monday to Friday. My colleagues are really hard working. We close the doors at 10 o'clock, but very often we won't be leaving this department until 11:30 because we finish seeing whoever's in here. And they're keen to do a good job. They want to give a caring service, and a compassionate bunch of people. And even though we have a high volume of patients, we still manage to maintain that. Being near a lot of residential areas and schools is a benefit to that community for sure.
I was quite surprised today when I was watching the television to see that there's no doctors, and that doesn't come over as, you know, the staff are so efficient and so good that it doesn't come over that there isn't a doctor here, that it is a nurse-led facility, and I think that's excellent.
Well, today I'm going out to visit one of the patients who we're providing case management for. What we find is there's a lot of complex cases out there in the community, and our district nurse teams, well, our integrated teams of health and social care staff can work together to keep people out of hospital, and the impact that has on people's lives is quite amazing, really. I have made a commitment really to dedicate one day a week to go out visiting teams, and as a leader it allows me to understand the services that the staff are providing. I can talk to them face to face, one to one, about any issues that they've got, but also gives me the opportunity to celebrate successes that they've quite rightly very proud of. To be able to talk to patients, to understand experiences, allows us to change things for the better. And it also helps when we're talking to commissioners who buy our services. We can get out and about, we understand the services and we understand the challenges and the issues.
It's quite busy, it's quite varied. You see a range of different people with a range of different communication problems. Okay. So you've been using your communication book?
Yeah.
Try and get that back of your tongue. So remember, if this is your tongue, you want that back bit to touch the back of your mouth. So we're heading to Stockton Brook, and there's a chap that I've got there. He had a stroke about 6-7 months ago. He's also got verbal dyspraxia. I'm trying to get him used to making the sounds that he used to make. Thought this week we could start by introducing some phrases for you to work on, practicing over and over again, like we've been doing with just the sounds and the words. Which wipe?
Which where?
Well, they've made a massive difference between them. They brought you on fantastically, and everyone who comes here notices that.
I think the work that I do really kind of gives the patients that have a problem with communication that incentive to kind of drive and go forward with it and try and get back to the normal function that they were before.
I go home and I feel like I've achieved something every day, really.
We want to help people and we want to try and improve their lives and make it better for them.
We're that voice of that patient in the department, that we're able to show that empathy and that understanding and feed that back across to the services.
It's all about trying to help others, and for me personally it's always something that I've wanted to do.
It definitely makes a difference to coming to work.
It's nice to go home at night and think I've done a good job today, and that person really appreciates and really values what we do.
I
I just like working with the patients. You know, I've done it for a lot of years, and I enjoy that. I enjoy doing the holistic kind of care.
Just makes me feel proud. The staff that we've got are the best in the country, so we just need to make sure that everybody else recognises that too.
I think it's been absolutely fantastic, and I never expected that much help.
I think what's been done and the care, wonderful.
Having the sports made me feel a lot more relaxed and a lot more confident in being a first-time mum.
My care over the last 2 or 3 years has been of the highest possible quality.
What shines through for me, it always is that the client, the service user, the patient's always first. And I just want to thank all of the staff for the efforts that they put into to make the outcomes for patients better.